Good day and welcome to the program COVID-19 Update on Silverbird Television Abuja. I am Georgina Ndukwe-Zainka, and this is the WeWe eWash COVID-19 Prevention Campaign brought to you by the Widows and Orphans Empowerment Organization, WeWe, with the support of the USAID Effective Water Sanitization and Hygiene Services eWash program. Widows and Orphans Empowerment Program Organization, that's WeWe, as I mentioned earlier, is part of the civil society organizations authorized by the United States Agency, International Development, Effective Water Sanitation and Hygiene program, eWash, to carry out a COVID-19 prevention campaign activities to stem community spread of COVID-19 in eWash partner states and, of course, Abuja. Now, this COVID-19 prevention campaign is a direct response to enhance federal government and partner states information and communication on COVID-19 prevention, provide improved access to accurate information on COVID-19, also aims at addressing the rising dissemination of fake news and stigmatization of COVID-19 survivors. We all know the spread of the novel coronavirus disease, now called COVID-19, has continued since the outbreak last year, since the 31st of December 2019, and as of the 6th of December 2020, over 66 million cases have been reported worldwide, including over 1.5 million deaths. In Nigeria, the death toll continues to rise. We have recorded increase in cases as at the latest statistics provided by the Nigeria Center for Disease Control. It reveals that Nigeria now has over 67,960 confirmed cases since the outbreak of COVID-19 in Nigeria. Well, the federal government has been implementing several measures to stem the spread of coronavirus. Now, this program is actually aimed at preventing further spread of coronavirus by creating more awareness on the importance of maintaining good hygiene practices and following the laid down COVID-19 guidelines to prevent further spread of the disease. Now, to shed more light on the COVID-19 prevention campaign, we have with us in the studio Dr. Josephine Ogazi Egwong, the co-founder, executive director, chief of party, Widows and Orphans Empowerment Organization. She is a Nigerian development expert with more than 20 years experience in international development, improving the life of orphans and children, widows and vulnerable women in Nigeria. We are glad to have you on the program this day. Welcome.
Thank you. I'm happy to be here.
Okay, so we'll just kick off the discussion with you, first of all, telling us about the WeWe eWash COVID-19 prevention campaign. What exactly is the focus of this campaign?
Thank you. The WeWe eWash COVID-19 prevention campaign is a campaign with a focus to help support to prevent the spread of COVID-19. So our focus is working to support the Federal Ministry of Water Resources and the Nigerian Center for Disease Control and the Federal Ministry of Health guidelines to prevent COVID-19. So what we do, we are carrying out a social media strategy to support the national guidelines and the national response to preventing the spread of COVID-19. Thank you. Okay,
like you've mentioned, you're actually carrying out activities, projects, and programs.
Yes.
What are those programs that your organization are dealing with, and how far has the journey been, carrying out these programs for Nigerians?
Thank you very much. We are a civil society. We are a civil society response. We are civil society response supporting the government response to COVID-19 prevention. And as a civil society, we are focusing on using the social media, where we have developed a social media strategy. And that strategy includes activities such as webinars. We have radio talk shows, and we have like this TV show. And the most recent radio show we had, we had a testimony of COVID-19 survivors, and that was really impactful for me, even as I watched last week when I saw somebody that is like me, and the first thing he said was that everybody blamed him, but really he was very meticulous about following the guidelines. but he still got COVID-19. And the good thing I learned from that is that he quickly took steps to get tested, and he got tested, and after getting tested and he was positive, he got treatment, and he has recovered. So looking at him, his testimony, it gave a good feel of, one, that this is real, because sometimes you move around and people are not wearing masks and it's like, oh, by faith this thing cannot never happen to me. But when I watched that program of a testimony of a survivor, it really drew home that this is real. And then I listened and I was able to understand what steps he took to recover, and then also it gave me hope too, that it wasn't a death sentence, you know,
true.
And that he's alive and so on. So we're going to have more survivors come on TV shows too, to talk, and radio shows. We also have jingles, we have billboards, and we also send out text messages, and all our strategy is to make sure that we support the national response to preventing HIV/AIDS through communicating to the social media network to as many people as we can. Thank you.
Okay. All right. That's a good thing that at least we all know that there are people who have contracted the virus and actually have recovered from it. There is a ray of hope, because I know how Nigerians feel. I don't want to die. Nobody wants to die, actually. All right. So I would have loved to find out, before we talk about the target audience, how do you feel the response of people to this campaign? Are they receiving it well? Because like you mentioned, there are so many people who are going around without masks on. Some I spoke to have said there is nothing like coronavirus in Nigeria.
God forbid. God forbid.
So, I want to know what has been the response so far from Nigerians in the process of creating this awareness.
I think the response has been positive, and the response has been supportive to the national response. Why? It's helping to disseminate correct information, you know, because there are a lot of fake, as you said when you were introducing, a lot of fake information about how, and also there's a lot of confusing information going about.
Yes, exactly.
Do this or don't do this, or you use this or don't do this, you know. So we were able to help use social media tool, which is a tool where more people are using now. We were able to use WhatsApp, we were able to use text, we were able to use webinars, shows, radio shows. The radio has a very wide coverage, and the impact has been that people are getting the right information about promoting hygiene, about because I notice now that unlike before, when people go to toilet, like when I used to talk to people, they'll say, okay, I only wash my hands if I do number 2. You hear that? But if I do number 1, I don't need to wash my hands. So what I've noticed now with seeing people that our target group is that there's that tendency to think about washing your hands number 1. If you know what number 1
number
means,
1 or number 2.
Number 1
I'm sure
and
we all
number
know
2. Number 1 and number 2. So that has been the impact, the correct information, and now it helps people to promote hygiene behavior and the correct washing of hands, and not only washing hands, the correct way to wash your hands. You know, really,
because before now people just wash and then you don't know there's actually a process of washing, even all within the fingers.
Yes,
you know, so.
And even in eateries now, you know, they just bring a bowl of water and you just put your hand like this. No, they have soap, and people really wash their hands. So I think we are contributing to the message being put out, and people are listening, and people have started to, at least they're not wearing masks, at least they're promoting more. They are getting hygiene practices. Yes.
So who are the people you're focusing on? Who are the target audience of the campaign? And okay, you've already mentioned some of the programs or activities that you are focusing on, but are they focused on the grassroots or just people living in the urban area?
No, we are targeting the vulnerable. So when I say grassroots means, you know, we're in Abuja. So when you say grassroots, you know, we don't have village in Abuja like that. But we are targeting vulnerable women, okay? And vulnerable women are made up of women who are low income, who are widows, that's our target group as an NGO. And that's one of the reasons why they wanted us to focus on the vulnerable groups, and also youths, and then people living with disability, and also the media, because we wanted to work with the media to help us to send out our message. Okay.
So we are looking at coronavirus and preventive characters, or how would I put it, preventive measures that one should engage in to ensure that you don't get infected.
Yes.
I want to draw from the example you gave about the man that got infected in spite of being meticulous in observing this. So how come people still get infected when they observe? And then there are some people that do not even bother observing, and yet they don't get infected. It's an irony. How does this happen?
Yeah, well, that's talking about transmission, and that's a medical issue. But what I've been able to analyze is that there are a lot of things that could happen. The virus is airborne, you know. So, and as they said, it lasts on the surfaces for some particular time. So even if the person has touched the place and has left, and you come there, you don't know that a COVID-19 person has been there. And another thing, a lot of people have COVID-19, but they don't know. And they don't test. I've heard that they don't test positive, but they have. It doesn't show. There's a term for it. They have it, and the symptoms, they don't have the symptoms.
Yeah, asymptomatic.
So, yes. So I think because of that, it makes it more dangerous, because you can actually follow all the guidelines and you can still contract it, because I guess it's because it's airborne, and because there's some people that are going around that think they can't catch it. Maybe they've already had it and their immune system
was able to overcome,
but they're able to spread it before they overcome. You understand what I understand? Yes, before you showed on them. So I think it's a complex, multiple transmission system. So I think what we can do is just put in prevention measures to reduce the spread. But I don't know. I think that answers the question.
Yes, yes, to an extent, yes, it does, yes. We are still discussing the COVID-19 prevention campaign being carried out by the WIWI organization in collaboration with USAID e-wash program.
Yes.
And it's Silverbird Television. You can call the number 081-0583-0411 to be a part of this conversation. For as many as would want to call in or ask questions or just make an observation on the program, please do call the number 081-058 is on the screen there, 081-058-3411 to be a part of the conversation. All right, so we will still move ahead while we wait for the calls.
Yes.
I would love for you to talk about how easy it would be to observe the safety protocols among school children. Now schools have resumed, and you know the nature of children. They would always want to play. They would always want to interact with their mates. How would it be easy to prevent, teach them the safety protocols as well as prevent them from getting infected? I don't know if you have any program in that line. Let's just talk about those measures you think should be put in place.
Yes, we do. We have particular schools in Imo State that we are working with, and these schools we work with the children and the teachers to teach them methods to promote hygiene behavior. And I must say that I've seen impact, because children are washing their hands. My son reminds me to wash my hands.
Wow, that's good.
Yeah, so
that's good.
I think it's working, and we have had direct interventions in schools in Imo State. And we have schools we are working with, and they have hand wash clubs, and we teach them how to wash their hands. And so we're contributing in that regard, working at the community level with schools at the community level in Imo State. That's what we're doing.
Okay.
Yes.
Well, that's good. Now, let's talk about the impact of COVID-19 across genders.
Okay.
How has it affected both the man and the woman?
Yes.
And now, women, of course, we know they make up the vulnerable group.
Yes.
But the men are supposed to have to be in the advantaged side, but we don't know. Let's just get to know, how would you say the impact of COVID-19 has been on both across genders?
Yes, I think that the impact has been different, but it has been the same. Different because it affects men and women in different ways. For the women, I would say that the vulnerable women particularly were impacted because they have income that two reasons. For economic reasons, the vulnerable women have income, daily income, by selling small scale businesses, which requires that they leave their houses to go out and transact. And during the lockdown, that was devastating for them because they couldn't do those sales, and it affected their income. Another thing is that women are part of groups. They are part of a susu groups, they are part of church groups, and that lockdown, and you know, since they are widows or they are single mothers, that was their family, that was their way of connecting with people. And during the shutdown, not being able to go out, that really affected them psychologically and mentally. So that was what happened to women. And for men, okay, I just need to let you know that we did an assessment. They call it GESI, gender equality and social inclusion. So that we did an assessment, and we went out and carried out focal group discussions with women, with men, and with people living with disabilities in Imo and Abuja. And then we found out these differences. So this is the differences I've been talking about.
Okay.
So for men, from that assessment, we found out that it really affected their morale because it reduced their income to be able to provide for their families. So that was very, it was emotional trauma for them too, because they couldn't have enough income to take care of their family. So that's what we found out. But both of them were all affected economically and affected their finances, and also there was a high level of hunger during that time. And even now things are picking up, but it still had a negative economic impact.
Okay.
Yes, thanks.
All right, so we'll be going for a very short break in the beat. We'll be back. It's still COVID-19 update on Silverbird Television, talking about the COVID-19 prevention campaign with the director, or the executive director of the Widows and Orphans Empowerment Program Organization.
The acronym doesn't link to
yes, it actually doesn't. So let's take a short break. We'll be right back with more on Silverbird's Rhythm 94.7. All right, welcome back. It's Silverbird Television Abuja, and we are discussing the COVID-19 prevention campaign on Silverbird Television. You can be a part of the conversation. You can call 081-058-30411. The number is on the screen, so do call in. Let's get to hear your comments, if you have experience, if you still have some questions about if COVID-19 actually exists in Nigeria. Call us and let us know if you have facts to back your postulation. But the fact remains that we have heard, we have seen, we have the data, we have seen the data, the number of people who have been affected or infected. Some have recovered, sadly some others lost their lives due to underlying disease that they already had. But we are talking about how to ensure that COVID-19 or coronavirus is reduced, how to bend the curve by ensuring you observe all the safety and health protocols, observing hygiene practice and all that. All right, I'm still with my guest, Dr. Josephine Ogazi Egwonwu, and we've been discussing this. It's been quite an interesting conversation, yes. And let's just come back to discussing what's the best approach towards educating. Now, let's talk to parents now. Let's talk to parents on how to best educate their wards and ensuring hygiene practice even when they're outside, especially when they're in public places, how not to touch surfaces anyhow. All right, so just tell us, what's the best way to educate children on health hygiene practices?
I'm also a parent, and I have children. My child is 10, 12, 14 boys, 3 boys. And I found out that they run around, they touch surfaces, and before you can tell them to stop touching surfaces, they have touched everywhere, you know. And so I think for parents, I think what you can do is teach them that to wash their hands more frequently. So after the child has touched everywhere, rolled on the floor, picked up dirt, at least you wash your hand So I think habits come after you do things frequently. I think if you do things 30 times, it becomes a habit. So you try to get the child to make it a habit. So the child always wants and washes his hands. So the parent, each parent knows their child. So you can then try to induce the habit. So get the child to frequently keep on washing. So the child just automatically becomes a second nature. It just starts washing hands frequently. So that's the duty of the parent, to understand the child and get the child into a habit of always washing the hand frequently. So even if the child plays rough or touches surfaces, or the child will be used to, you just be used to washing hands. Is that what you were saying? What were you saying?
Yeah, you know, mingling with friends as well, because you could actually, or they could actually get infected if their friends are also infected as well. So there's a thin line. One has to really be careful.
Yes, it's a thin line. But I thank God children have higher immunity, but doesn't mean that they can't get infected. But I think schools are trying to do a good job. I know my son, if he forgets his face mask, he can't go into the class. He has to go home. They will call me to come and take him home.
Wow.
Or he had money that time, he forgot, and he bought a face shield, 600 naira. So schools are, and the distance between, but after that they go and play together.
That's the thing.
So it's just frequent washing of hands, I think, and
go a long way.
hygiene, and keeping them like frequent bathing, frequent washing of hands, and avoid taking children into places where there are a lot of traffic of people, human beings. Yes.
I know you deal with vulnerable women.
Yes.
And these women may not have the resources to buy hand sanitizers.
Yes.
So how do they deal with, you know, ensuring that their hands are clean at all times? Is it making available water and soap close by for those in the market? How do they handle this?
Yes, I think potash or ash has been recommended as a cost-effective way for women that don't have resources to wash their hands. And I think it's true, because if people in the past, washing your hand was just putting your hands in water. That means your hand was your hand was washed. But I think with our campaign and other people's campaign, a lot of people understand that washing your hand with only water now is not enough. It's
not enough.
So that, I think everybody knows that now. I think everybody has gotten that message. So the next stage is how do you afford, a vulnerable woman afford to buy soap, you know? So I think we recommend them to use ash when they finish cooking, and they keep the ash so that they can use it to wash their hands. As
that's an alternative that is even cheaper and more available.
Yes, and they have cooking pots outside, you know, so it's homemade and they don't have to go out and get it.
Great. Okay, so we've been discussing the COVID-19 prevention campaign. This program is brought to you by Widows and Orphans Empowerment Organization with the support of USAID Effective Water, Sanitation and Hygiene Services, called E-Wash program. Remember, we can prevent the spread of COVID-19 by taking these 3 easy steps. Wash your hands with soap and water for up to 20 seconds. Avoid contact with your nose, eyes and mouth. Maintain social distancing. And of course, don't forget to wear your face mask. My guest has been Dr. Josephine Okazi Egwonwu. She is the Executive Director of the Widows and Orphans Empowerment Organization. Yes, for sure. And I have been Georgina Ndukwueze-Zainka. Next week Thursday will be another edition, or this Thursday will be another edition of the program. So join us then for more discussion on preventing COVID-19 spread. Thank you so much for watching. Stay blessed and stay safe.
Thank you.
you.